Assalamu alaikum. I'm Dr. Kainat, a physical therapist. Here on my YouTube channel, you will see and learn those musculoskeletal conditions and neurogenic conditions that are related with physical therapy. Such conditions that are rarely diagnosed, or you can say not diagnosed at all. We will inshallah discuss those here. Before we start, I want to request kindly like, follow and subscribe my channel, and also press the bell icon to get notified. So here we start. Today's topic is Hoffa Syndrome. Hoffa Syndrome or Hoffa disease is first of all, the name Hoffa, it comes from the Albert Hoffa, who was the person who first described this condition in 1904. 1904, yes. Hoffa disease is also called Hoffitis. It is also known as infrapatellar fat bed syndrome. It is a problem which affects one or three pairs of fatty soft tissue that lies under the kneecap patella, and it will lead to the pain at the front of knee most commonly. Hoffa fat pad, it act as a protective cushion which separates the kneecap from the shin and thigh bone. If this become pinched or damaged, squashed, it will become swelling, inflamed and soreness, you can see. It increases in size after it has become swollen and is more likely to get pinched again and again. If this cycle can lead to a lot of pain, the front of the knee, that is hard to get rid of. Now, what is the causes of this syndrome? So the Hoffa syndrome can be happen for the number of reasons. Okay? It could be caused by any sudden injury, like such as a direct hit to the knee. It tends to gradually develop over time if the knee is repeatedly extended. This is when the knee is forced beyond its fully straightened normal position, like in an hyperextension position. The patient may have history of being able to overstraight the knee, hyperextend, which is known as hyperextension, obviously. Other causes includes like tight quadriceps, forward dippings of the pelvis, or any history of osteoarthritis in the knee or anything. So now we come to the symptoms. The symptoms of Hoffa syndromes may include the most common symptoms that patient usually ask for is that is a pain at the front and the side of the knees. First one is this, and the most common is that the patient feels the pain, a sharp pain, while you extend their knees. This is often hard to pinpoint, and there has been no clear injury. Activities such as climbing the stairs or even sitting with the knee bent are painful. In some cases, there is a background history, like or any occasional joint or jolts of sharp pain, but generally there is a swelling below and around the knee. As I said, pain in straightening the knee while extension, or with prolonged walking too. Yes. So after symptoms, now we come to the diagnosis. How can we diagnose the Hoffa syndrome in patient? Usually a physical therapist or orthopedic specialist or sports doctor, they look for the symptoms that I have told you before. After that, they'll perform a clinical examination test that is called a Hoffa's test, which involves moving the kneecap after the patient contracts the quadricep muscle. Yes. This test you can perform while the knee is slightly flexed, and also when the knee is straightened up in extension position. In the inferior and the middle part of the kneecap, press from your thumb and the index finger. You have to press in towards the inward movement, in the inward direction. You have to press it and ask the patient to contract their quadriceps. If the pain it increases, so it must be the test is positive. Okay, after the diagnosis, now it comes to the treatment. Hoffa syndrome is treated. Firstly, obviously we have to do the pain management and calming the patient by to reduce their swelling, and then secondly, stopping the pinching and squishing of the condition. This can be achieved with the rest and medicines. We usually prescribe them anti-inflammatory injections. Usually three injections will helpful for the patient. Further treatment includes it's a physical therapy treatment. Taping the knee. K-taping will be very supportive, you can say. And after that, you have to strengthening the muscles by giving the strengthening exercises, isometrics, and also it may be advised to see a sports medicine professional such as a physiotherapist or a orthopedic surgeon. A specialist can apply a small anti-inflammatory injections to the fat pad. Yes, first of all, if you are subscribing any patient that anti-inflammatory injections, you must have said that it is on the fat pad, not on the articular areas, to calm the inflammation and to physically shrink that fat pad, Hoffa's pad. If the condition is severe, then up to the 3 injections are needed at least. Surgery is not usually recommended treatment for the Hoffa syndrome, but in rare cases, a gentle minor surgery to trim out some of the inflamed fat pad can be performed. Okay guys, here is we done with the Hoffa syndrome. Hope you guys liked it, and if you liked it, kindly subscribe my channel. Thank you.